managing the whole pandemic is a huge challenge. And it's not a one man show. It's not just the government. It's not just the health ministry, but it's every one of us.
Creative Conversations.
Hey Zouk family, welcome back. Another week talking to a regional hero, and this is the very definition of hero. I say this totally honestly when I say I've been fortunate enough to interview many famous faces from around the world in entertainment, but the word hero is overused basically for people we admire. However, Dr. J is on the front lines, 7 years special forces, the medical side of things. He has been battling COVID on two fronts. First and foremost, by looking after people who are affected with the pandemic. But second of all, he is unfortunately in quarantine, having been affected by COVID. So first-hand experience from both sides. First and foremost, Dr. J, I always ask people how they are. I think in your circumstance, it's a little bit more of an intense conversation. But how are you?
Thank you, Joe. Thank you for this whole setup. You know, it's great to be actually able to speak and interact with somebody and to share my insights. And it's an honor to be here. You know, you've spoken to a lot of famous people, like you said. So I'm honored and flattered that I could be on your show. So yeah, I'm feeling much better now. So I got tested positive about a week back, PCR test. So my first test itself was positive, and it was a big shocker to me. And currently I'm in quarantine at home, thankfully. I just had mild symptoms in the beginning, so I decided to go and get myself tested. Unfortunately, it was positive. So yeah, I'm at home, but I'm doing great. But what I would like to share with you is, you might think that the symptoms that you are experiencing might just be a common flu or cold, So what really made me go and test was these symptoms that I started experiencing was slightly away from norm. So I was down with some sore throat, some runny nose, and severe fatigue. So the fatigue was the actual thing that actually made me go and test. And because I'm in the healthcare side, so we are offered the PCR test straight away, and we get the results within 12 hours. So I found out that same day and went to quarantine. So away from family, although, family is just outside the door, but, the struggle is real. My son is like knocking on the door, like, Papa, but, we have to, it's our responsibility not to, be around them because we are infectious, especially in the first 10 days. So that's the reason why we need to be in strict quarantine.
Can I ask you, if you don't mind, so the symptoms you felt, the fatigue, the flu-type symptoms, what was it that got the fatigue? Can you describe it in a manner that, aside from just waking up and feeling a bit groggy, or you've been for a run and you're quite tired, what were the elements of the fatigue that really made you think, I need to get tested? And number two, you mentioned to me just before we jumped on the recording that a lot of people are asymptomatic. Can you really stress to people, please, because no one will know better than you, the importance of A, testing, and B, taking the correct precautions? Because I think one of the reasons, and I can't specifically speak for Malaysia, but if I look at the UK, I look at the USA, a lot of people are not taking it seriously, are refusing to wear masks and following behavioral patterns that are not helping stem the number. But you would know firsthand how important it is to take this seriously.
Yes, definitely. So when we talk about personal protection of personal protective equipments, it is very, very important that everyone adheres to this. So in simple terms, it's face, hands, and space. Face, wear a mask. Hands, keep it clean. And space, watch a distance. Just by practicing these three measures can significantly reduce the risk of a person getting infected from this. So oftentimes, I mean, if you look at a young and healthy individual, no illnesses, and so often these guys are asymptomatic and possible carriers. A person wouldn't know that he is actually a COVID positive or not. However, it is in our conscience, and it's our duty as a human to actually practice these norms to protect others around us, especially those who are more vulnerable to a more severe infection. For example, the elderly, those with chronic illnesses. So these people are more susceptible, and will the severity of the disease is much worse than a normal healthy adult. So it is very, very important for everyone to actually take these measures and practice them like it's the new norm. Okay, at least for now. Okay, so what we are planning or we are aiming for is herd immunity, like everyone is talking about right now. You know, the vaccines are out. Many countries have already got them rolled out. Some countries have already achieved it already. So, like in Malaysia, we are rolling out the plan real soon, and we are hoping to achieve 70% of herd immunity by February 22. So, once a herd immunity is established, that's when we can actually start relaxing the SOPs, the measures to prevent any further spread, or So it's going to take some time. I know it's not a nice thing to hear from the from your industry, especially because I know you're affected badly by this pandemic. But probably it's a good time to start recreating, or probably thinking of new ways to get the business going again. Start implementing some new ideas, crazy ideas that would work.
So it's funny you say that, because Zouk Singapore became a spinning studio, also became a cinema. So there are ways, but I think don't worry so much about our business element in the context that overall safety and people saving lives is dramatically more important.
Yes.
Don't get me wrong, maintaining jobs and helping people maintain a livelihood is vitally important as well. But I think the overall message of what we're trying to convey today is that the faster we all lower the numbers of people that are affected and the sharing of the virus and germs, etc., the faster we will get back to normal, you will get back to normal, and get back to normal. If we look at the other side, Dr. J, what's really fascinating about your scenario is we've obviously tackled the unfortunate nature that you have contracted COVID, but you've also been looking after a lot of people that have COVID. You are a doctor by trade, 7 years with the Special Forces. How did you end up being in the front line for this specific reason, for this pandemic? And being totally frank, what has been your experience at looking after people during this really difficult time?
I remember it quite clearly. This was early March last year. And so in my line of duty, so we see patients day in, day out, and we do a lot of management related work as well. So when we had our first case, we did not expect it, to be frank. Okay, we did not expect it. And so the measures that we took in managing the first patient, it was, I would say we're thankful. I'm thankful that I had this in my training, being in the Special Forces and all that. So I was exposed, or I underwent some training in CBRNE, chemical, biological, nuclear, and environmental warfare. So the part of COVID is very relatable to biological warfare. Right. So the precautions that we took were based on those guidelines that we have already set. Okay. So containing the patient and containing the situation at that time, it was manageable. However, when the numbers started growing up because of lack of enforcement and SOPs in the general public, that is when we started seeing a huge influx of cases. So we were not talking about one patient, but we're talking about hundreds at that point. It did not reach thousands yet, hundreds. The utmost or the biggest challenge that we faced was actually the contact tracing part of it. So we have to find out who has this person contacted with, and where has he been throughout this period of 2 weeks. So getting that information in, getting the details of the people that he has contacted with was the biggest challenge. So when we don't get this information and when we put it out there in public and people do not come forth and get tested, that is the biggest challenge, because there will be spreads within smaller communities. Getting to these people was very, very difficult. The number of cases that were actually reported maybe was far less than the actual scenario. What we did quickly after we diagnosed the first patient is we had to set up quarantine centers. So we need to quarantine these guys in a place that they had good access of conducive environment, food supply, medical, and also other emergency care. So a lot of things needed to be thought and also planned before we could actually open up more centers. So I think on general, initially we did a good job. Initially we because the numbers were small. But after the movement control orders, and then it's been relaxed, and then it's back on and all that. So there was more travel and there's more interaction of people, and that actually caused the second and the third wave to come in. By far the most challenging is actually the current one, the third phase, because like you see every day, it's like, from 3,000 to 7,000 we had the past few weeks. It is real, and so now what we're doing is, instead of putting all patients in quarantine centers, those who are asymptomatic can be observed or can be quarantined isolated at home, provided they have the right environment. So which means a room with an attached toilet and access to food and water. So now all of the tracing of the management and monitoring of the patients who are diagnosed are actually monitored through an app, My Sejahtera in Malaysia. So every day you key in your there'll be like updates, and you have to update your general health status and your symptoms as well. So you're monitored through there. So if at all it's flagged, the authorities will contact you. So that's a good move by our government for trying to move things online.
Can I ask you a question, Dr. J?
Sure.
There's a clear message coming from you that the contact tracing, while it's not perfect, is a huge valuable asset in finding out how the spread could have manifested. So therefore, people who are going out and they're not scanning in entry and they're taking it in a lax manner and they're saying, oh, it's not that relevant. It's hugely relevant, right? Because it also helps. Because as you said, let's say you and I had lunch together, you turn out positive. just by scanning, we can locate that I was in the same restaurant at the same time, and therefore I can go and get tested immediately, which may mean that I can't spread it to an elderly parent or a young child. It's super important, though.
Correct. That's right. 100%. So we have to do our due diligence in that, and the establishments have to enforce these measures as well for everyone to take part in this, because through the app, it's helped us a lot in the contact tracing, and I would say that it's much easier to do it online rather than the old school method of actually like calling the person up and asking where have you been, so and so and so. That was actually happening back then when it first started, but quickly we adapted, and there was a good solution, jumped onto it, and so now we are entering our, I think the second MCO of the extension of the MCO 2.0, and we do see a reduce in the cases, thankfully, especially because of probably the number of people who are moving is not as much as before. However, once we are back to once the MCO is lifted again, we still need to practice these new norms. It just should be a part of us. There's just no two way about it.
Can I ask you a question? And I'd like you to be as direct as you can be. You've been looking after people who have COVID.
Yep.
Just so for the people who don't think it's that bad, or the people who are not so scared, how bad can it be, especially for someone who's elderly? What kind of difficulties can they go through?
That's a great question, Joe. So it can be from asymptomatic, or it could be severe disease. So say in a population of 100 people, right? Population 100 people, 80% is asymptomatic. They have the infection, but they're asymptomatic. Okay. Another 20% is the more vulnerable population, the elderly, those with chronic lung illnesses, other diabetes, hypertension, heart problems, and so on. So these guys are in the 20% category, right? For example, say we blow the scale up to the whole country, okay? We would not have, so this 20% or this 20 people will now become 20,000 people. The severity of the disease will need you to have more advanced medical support in terms of ICUs and ventilators. So given a country like Malaysia, we are good in our healthcare, but imagine 20,000 ICU beds. We don't have that. Okay, and I don't think any other country in the world also can cater for that kind of number. So that is the reason why we need to, or we are working hard to bring the numbers down. Because if it happens at a go, without any control, without any SOP measures, it's just going to be a mess. All the hospitals are going to be full, the ICUs are going to be full, and these this population of people who are susceptible would not be able to get the treatment and the medical care that they need. So it's going to be overbooked ICUs and all that. So and definitely it will correlate to a higher mortality rate. So more people will be dying from the illness. So I hope that answers your question. How the severity of the disease can actually impact, the whole nation as such. So it's in our duty to stop the spread. Of course, you and me, probably just some mild symptoms, not severe, but what happens to our loved ones? What happens to the elderly, kids who are having those immunocompromised kids and all. So everybody plays a part in this, and managing the whole pandemic is a huge challenge.
and it's not a one-man show. It's not just the government. It's not just the health ministry, but it's every one of us.
Thank you very much for highlighting that, because I think it's very easy to look at the numbers that come out every day on my searcher and just there's two points of thought. I feel it's very hard without knowing firsthand, as you do, what it's like to care for so many people. Secondly, not to understand the numbers as severe as they are, just because people look at a day-by-day snapshot, but they don't tend to look at the total number that is currently being looked after at any one point. We're simply just adding cases, where it doesn't mean that there's 3,000 in existence. It means we're adding 3,000, adding 3,000, adding 3,000, adding 3,000. And as you say, we're just not equipped. No one is equipped for that many. I've seen pictures of sports halls full of people, and it's not a knock on any government or organization, because no one was prepared to deal with such a pandemic. Looking at it from the other side, so you're in quarantine now. You said your symptoms are less severe and you're feeling much better. What is next in 2021? What do you want to enjoy once the numbers come down? Obviously, you've had the rough end of it now. You've been stuck on your own. First of all, how are you entertaining yourself in quarantine?
Oh, I'm actually not entertaining myself, man. Work is work. Work still goes on. There's still like 2 or 3 meetings a day online, and reports and paperwork and all that. So all of that goes on. So it's basically I'm just working from home for 2 weeks. So
just in isolation, though.
Yeah, that's about it. But work is still the same. No off days. On Sundays I'm working too. So yeah, it's all for it's all for COVID, man.
And what are you looking forward to? What's the first meal you're looking forward to enjoying with your loved ones once you get out of quarantine?
Not much of a foodie, but I just can't wait to hold my son.
Yeah, I'm sure.
Yeah.
I'm sure. How old is your son?
He's 5.
Does he quite understand the context of why you're in a separate room?
He's a smart. Kids nowadays are really smart, man. So initially we didn't want to tell him that it was COVID, but then he figured it out. Put 2 and 2. This guy's in isolation, and he called me and said, "Papa, do you have COVID?" I was like, "Yeah."
But yeah, we wish you the speediest recovery. My last question is, if there's one message that you think you really want people to grasp onto, you've obviously covered a huge arch of your experience from both sides, obviously the severity, how we can avoid it, and the importance of, as you say, the new normal in the protective ways, as you say, face, hands and space, that we can deal with getting this down. If there's one clear message you want to make to people watching this, what would it be?
Stay calm, stay composed. We will get through this very soon. The vaccines are coming out and it's pretty safe. We will get through this, definitely. So just maintain your SOPs, face, hands and space. Looking forward to, living life back in 2019 again.
I don't think you're the only one, but look, in your time where you're stuck there, if you just get a few ingredients, your friend Alex has done a few cocktail and food masterclasses.
Yeah.
You could just log in on YouTube and watch those.
Yeah, he sent me some links. Yeah, it's pretty cute.
Look, Dr. J, we really appreciate it. I mean, as I say, it's you and all of the frontliners, all of your friends, all of those who are working so hard for the benefit of other people. And I stress it is for other people. You're basically trying your best to cure and also limit the exposure to other people. And that does make you heroes, because there are people whose lives will be saved because of it. And as small a voice as we have, we just want to say thank you. And second of all, wish you the speediest recovery so you can pick up your son with a clear conscience soon.
Thank you. Thank you so much, Joe, for having me.
No worries, and we would love to invite you up to enjoy yourself, but I think it's more like 2022 than 2021.
Yeah, sadly, but yeah, that's true.
Take care, and thanks again for your time, and good luck and speedy recovery.
Thank you very much, Joe.
Take care, my friend.
Cheers, bye.